So good morning, everybody, and thank you again for being here. I'm Athena. I know many of you around the room. Today, I wanted to share some information on stress and mental health and farm worker well-being with you and talk about some of the work that we've been doing over the past couple of years related to mental health and stress among the farm worker population. Let's see. There we go. So I wanted to start out first with a definition of health. And according to the World Health Organization, health is a state of complete physical, mental, and social well-being. It's not merely the absence of disease or infirmity. And so when we look at that definition, we can see that there's really three parts to what we're considering health. There's the physical well-being, which I think all of us understand that physically we need to be feeling well, but it also includes mental and social well-being. And oftentimes I feel like those are things that we forget about that are a part of health. And so this definition by the World Health Organization was actually created in 1948. And it was at that time groundbreaking because it was because of the breadth and the ambition of the definition. But I think, almost, 100 years later, it's still something that resonates with us in thinking about these different domains of health, of physical, mental, and social domains. So what does mental health mean to you? Maybe we can throw up put some ideas, in the chat about what does mental health mean to you? Go ahead and take 30 seconds and put a definition there. What does it mean to you? Okay, so we see peace, joy, being able to cope, a state of mind, mental and emotional state of mind. Excellent. Self-care. Very good. What about having no worries or worries for a worker to be healthy mentally and physically? Yep. So what if I said, what is good mental health? How can you tell a person with good mental health versus somebody who's maybe having a little bit more difficulties? What might be some of those characteristics? Okay, somebody who's self-aware would probably be somebody who has a little bit better mental health, right? They're self-aware, they maybe have good self-esteem, they have a sense of identity, they know about themselves, what their strengths, what their capacities are. Maybe it's somebody who has a really good idea of reality, somebody who's enjoying life. They tend to be happy. They tend to have relatively good relationships with other people. They get along. Can you think of any other characteristics of good mental health? They can give love and they can feel love or affection. They have boundaries. Exactly. Very good. So I think these are all important things for us to think about and to realize that sometimes our feelings are based on, our mental health is based on the situations that we're in, but it's also sometimes based on structural issues. And we're going to talk about both of those. Oh, goodness. So within the agricultural worker populations, what we know from the research is that ag workers do experience high rates of mental health concerns. For example, depression, anxiety, and stress, which can be related to a lot of different factors like being geographically isolated in rural communities, maybe being culturally or linguistically isolated, because a lot of times and you all know, in many of these rural places, people don't understand or don't speak second languages or multiple languages. And so people can feel very isolated in those communities. They may have experienced trauma in the migration process, pre-migration, during the actual migration from wherever they came to the United States. And also there's the acculturative stress of adapting and dealing with life in a new place, in a place that maybe you're not familiar with. They may be dealing with poor working conditions, which we talked about already this morning, maybe some marginalization or feeling discrimination in the community, and being separated from friends, family, and other types of support systems that they may have had in their country, and lacking some of those social supports of being here in the US. Now, what we do know also is that there are really persistent and daily strains that many of the workers that we interact with experience, right? And that sometimes, there isn't resources for many of the people that we work with. Or if there is, there's a lot of challenges to being able to access those types of resources. So depression, anxiety, post-traumatic stress disorder are typically relatively prevalent among farm workers in the US, but they're usually left untreated for a number of different reasons, whether that be the geographic accessibility, financial and cost issues, just not even knowing that services exist. Maybe, there isn't any services that are available. So for a lot of different reasons, we know that they are prevalent, but they're often untreated. And there are a number of studies that have pointed out that there are kind of like these ebbs and flows of these mental health conditions throughout the agricultural season, depending oftentimes on the level of stress that goes along with certain jobs or times of year within agricultural production. And we also know that sometimes substance use substances like alcohol are used as coping mechanisms or coping strategies for dealing with a lot of these things. And alcohol use, particularly among men, is pretty common. So if we look at anxiety, we'll just take each one of these apart for a minute. So looking at anxiety, often anxiety and depression tend to go hand in hand, and about 30% of farm workers in the US do report some symptoms of anxiety. In depression, there's a lot of research actually among farm workers related to depression, and what they found is that Latino farm workers in particularly are at high risk for developing depression. And as I mentioned, they're unlikely to seek out services. So when they do seek out services, it tends to be through primary care clinics, community health centers, those types of places. So a primary care provider. And often primary care providers are not sufficiently trained to be able to screen for depression and to be able to understand all the nuances that are associated with many of the mental health conditions that people may present with. And so they may think that some of the depression or the depressive symptoms don't warrant any type of intervention. And there was a study that was done regarding the use of healthcare among farm workers, and what they found is that those who had depression, so the farm workers who had depressive symptoms, were more likely to access any kind of care than those who didn't have depressive symptoms, and that usually happened through that primary care provider. And about 30% of the migrant farm workers in the US do display elevated depressive symptoms. So it is something that is pretty prevalent. And what we found is that harsh working conditions, worrying about immigration-related fears, feeling like your job was insecure, and discrimination were significantly associated with depressive symptoms. Stress. That's kind of like the key word. In fact, there's a lot of funding right now and a lot of work that's going on related to stress within agricultural populations. So not just farm workers, but also farmers and just more broadly in rural communities. So what is stress? Stress is a physical or a mental response to a situation, an event, or a feeling, and it's something that can be positive or negative, right? There are certain things that, like maybe you have a deadline. That could potentially be a stressor, right? And sometimes when you have a deadline, that's good because it pushes you to get something done. So that's an example of a good stress. But when you have too much of that stress, or you have it so frequently, or it never goes away, that can also be a chronic stress and can be a bad stress. So there are positive and there are negative stressors, but stress over long periods of time can lead to health problems. Like high blood pressure, diabetes, can be risk factors for diabetes, and mental health concerns, of course, like depression and anxiety. So one form in particular of stress that we found to be really important when working with farm workers is the idea of acculturative stress. So what do we mean when we say acculturative stress? Well, we mean that it's a response to the adaptation or the change that's happening in somebody's life between where they came from and where they're now at. So if you think about, perhaps you're an immigrant yourself and think about your country, and there was probably some norms, some values, some beliefs, just some ways that you did things that are very different than the way that life in the United States tends to run. That's an example of acculturative stress. So stress is always part of the migration experience, but also we need to think about the context in which that happens. As you migrate from place to place or from one place to a new home, there's a lot of uprooting that happens. There's a physical uprooting, and meaning that you're physically moving a home from one place to the other, but there's also social and cultural uprooting that changes the way that life is. And those changes, those stressors can result in a lot of different things like dysfunction in the family, negative expectations, maybe just some real trouble coping, which may lead to suicidal ideation or substance use or putting yourself down in comparison to others. Those are just a few examples of acculturative stress. And among the migrant farm worker population, some of the things that we found to be really important in terms of depression is thinking about the economic situation that people and workers and their families are living in, thinking about the immigration situation that they may be experiencing. Perhaps they're undocumented, but maybe they're a mixed status family. So there's a lot of challenges when thinking about immigration. Does create a lot of stress for workers and for families. There's challenges related to parenting and to raising children, especially when you're when maybe you grew up in a certain culture and doing things a certain way, and in the US it's maybe quite different from how you grew up. And then social isolation, being socially isolated, geographically isolated. Those are things that we found here in Nebraska to be associated with depression. Now, anxiety, what we found to be the strongest things that are associated with anxiety are the economic situation and the social isolation that people experience. So as I mentioned, there are situational stressors and there are structural stressors. So situational stressors are those things that may be temporary in nature. They may be conditions that can change over time, and things that could potentially change across the agricultural season. So for example, people may be moving from place to place, so housing conditions may be different. Working conditions may be different as they change between employer to employer. Weather, of course, changes across the season. We know that. Family situations may change. So you get the idea. There's situational stressors, and then those structural things are things that are less likely to change. And these refer to more broader or social economic forces that affect farm workers, like discrimination, like poverty, like dealing with immigration related concerns or that acculturation process. So these things tend to be relatively stable and seem to be a little less temporary. So we know that everybody is going to experience stress at some point or another, but how you deal with that and how you mitigate that is really the question, right? And so hopefully, you know, what we can do as service providers is to change some of those structural stressors, maybe change some of those situational stressors, but also help people to better cope with stress. And among farm workers, I've told you that there's lots of common stressors. Like occupation, like just dealing with all the stuff that goes on in the farm work environment, the relatively low wages that people receive, and dealing with a lot of discrimination and access and availability issues for services, including healthcare, education, and so forth. And so you can have negative and positive coping strategies, as you can see here on the slide. And so sometimes you can mitigate that stress before it actually becomes something much more difficult to deal with, which is that idea of distress. So what the National Advisory Council on Migrant Health stated in 2019 is that unrecognized and unmet behavioral health needs, largely resulting from the trauma of migration, navigating a new community, and the cultural stigma associated with seeking care for mental health issues, have a significant negative impact on farm workers and their families. So here in Nebraska, back in 2016, we conducted the Nebraska Migrant Farm Worker Health Study. And with this study, we did surveys with farm workers between July and September of 2016. We had 241 people who participated in the study. But what you can see here is that workers had really little access to healthcare services. Very few had health insurance, very few had a regular healthcare provider. And you can see that about 30% reported being anxious, about 20% reported being depressed, about 18% reported being stressed, and then we had about 14% who had some issues with alcohol and with drinking, and a very high prevalence of tobacco use as well. So 31% of the people that we talked to were current smokers, so we're using tobacco. Now this shows you that we have a lot of issues here, and you know, part of our work at the university is to be able to document these issues and to explore some of the potential health issues that may exist for populations. That's part of what public health is. And so we've been able to identify some of those problems, as you've seen there. But we've also identified that there are a lot of issues related to the availability of healthcare professionals. So if you look at the map here on the screen, you can see that 88 of our 93 counties here in Nebraska are designated as mental health shortage areas by the U.S. Health Resources and Services Administration. So really, it's just Omaha area, Douglas County, a little bit of Sarpy County and Lancaster that have sufficient mental health, behavioral health care providers, but pretty much the rest of the state is our shortage areas. And that's particularly important when you're thinking about folks who may not speak English as a primary language. And then you see even more shortage areas across the state because there is very, very little multilingual behavioral health services in Nebraska, and actually throughout the whole Midwest region. And I forgot to add this, but we actually have a list now that some of our team members have put together of multilingual services throughout the 12-state region. So I'll be sure to to share the link, or if Maria Jose, if you're on, maybe you can share that link, or Rashad, you can share that link with everybody in the chat. That would be great. We also have talked to farm workers about how much they know about community resources, because you know, if as you go into communities as a service provider or as somebody who's done this a couple of times, you get to recognize, yeah, there's certain things in communities that you would pick out, churches or food pantries or nonprofit organizations or so forth, that we would know that those could be potential resources for farm workers. But when you ask the farm workers themselves, they know very little about the resources that exist in their community. So based off a study we did with hog confinement workers, you can see here on the slide that about 75% of the workers we talked to were not aware of any community organizations like food pantries or social service agencies. About 63% didn't know anything about organized sports or recreational opportunities in their communities. 71% didn't know about any adult education programs that were in their community, and 82% didn't know about any activities that existed for kids or for young people in their community. So there's a lot of opportunity for us to be able to share more information about community resources that do exist, and these are potential things that can help people better cope, develop positive coping strategies, or help mitigate some of the stress maybe related to poverty and food access and so forth that people may be experiencing. Our friend. And so there's been a lot of work all across the country to think about best practices for serving minority and Latino communities related to mental health. And so some of the best practices that they've noted are that you should promote wellness, right? It isn't about diagnosing that you have something wrong with you. No, it's about creating more of a sense of wellness, a sense of wholeness, that we have a lot of strengths, so we're building off strengths. We try to reduce some of the stigma that's associated with mental health, right? When you say mental health, usually people are like, I'm not crazy, I don't need help. And so there's just a lot of negative connotations when you talk about mental health. So the more that we can have open, honest conversations about mental health and just make it, more of a, well, just like you talk about heart health, you talk about, getting some exercise, the same could be true for mental health if we talked about it more. It's also important to really build community capacity so that we're not always reliant on a healthcare professional. So we're not always reliant on a psychiatrist or a psychologist or a counselor, but that there is some capacity within community agencies to be able to handle some of these issues as they arise. So building up that community capacity, and actually I have a couple of ideas that I can share with you here towards the end about how we can do that. We also need to have some outreach and education strategies. So it's not just about, educating service providers, but it also is about actually reaching out to community members and talking about mental health issues. Best practice is to engage peer-to-peer type of learning opportunities and using family-based models and co-locating services together. I think when Danny asked the question this morning about what's one of the things that we could do to improve services, this is a good idea, to co-locate services, to do outreach together so that we're working hand in hand, side by side with each other over time. And these, I think, are important, and they've led me to think about what I'm calling now the 3 C's. So the first one, convivencia. So this is about being with people, and it's to live in harmony, basically, right? And so it expresses this dynamic and interactive concept of living together harmoniously in a human group. It's the art of living together. This is, I think, important for our farm workers and for how we engage with farm workers, because what we found in many of our interactions is like you need to be able to sit, have time, have a conversation. It's not just about let me fill out this form, right? Let me get what I need, but it's also about being there when they need you to be there and to listen to whatever it is that's on their mind. And so this is a form of sharing space and time, an active way that we can do this together. And on the screen, you can see some of the ways that our team has has tried to really embody this idea, this principle of convivencia, of being with people, sitting together in the circle, playing games together. You know, sometimes I know all of the managers and supervisors won't like this, but it is important to be able to have some of that downtime. And sometimes, you know, having that more informal time and informal interactions with people is what actually facilitates and eases the formal work that we all need to get done. The second C is about connection, or conexión. And we've really tried to connect with people on a much more human level. And trying to build friendships, to establish more long-term relationships. And this is something that, you know, in the public health world, we think is really critical. It's a vital sign, just like you would take blood pressure, or you might take height and weight. The same is true for understanding connections, because we are all social beings. As human beings, we need each other, and that's part of how we create this whole idea of wellness, is to be with each other and to have those connections. So this idea of conexión is something that results from perceived support and inclusion, and we can develop that through a lot of different ways, but one of the most important ways, we think, is through the face-to-face connection. I think all of you, especially the recruiters and the service providers on the call, you all know about the importance of that face-to-face interaction, that connection with families. We all passed through COVID, and we all had to rely on those virtual means of interacting with people, and that was difficult. It was really hard. So I'm really happy that we're able to get back together with people in person, because I think that really does help to establish that connection a whole lot quicker. And it helps to build that rapport and to build that trust with others. And the third C is about conversation. And we know that conversation and dialogue are important tools, especially in collectivistic types of cultures, right? Where we have a lot more reliance on storytelling and on narratives and sharing experiences. And so this idea of conversation is something that helps us to build resilience. So helping people to successfully adapt to all of the things that may be changing in their lives. We can have these conversations in lots of different ways. So for example, it could be a dialogue, could be a testimony where somebody is, you know, telling their own personal experience, or it could be just a way that we have group discussion. And so that, you know, I'm not always the leader of the group, but everybody gets to be a leader, everybody gets to be a teacher, and we're all learning from each other in some form or some fashion. So those are the 3 C's. So we got convivencia, conexión, and conversación. So now I want to tell you about the program here that we've been working on over the past couple of years. And some of you are familiar with this. So over time, we've been collecting information, we've been collecting research data, and we've been able to identify some serious concerns related to mental health. But now the question is, well, what do you do with that, right? So it's not enough to just collect information, but we have to be able to take action on the back end. And so one of the ways that we're doing that is through a program called Bienvenido. And bienvenido, for those of you who don't speak Spanish, it means welcome. But this is a strengths-based curriculum that focuses on emotional well-being and adjusting, or those changes, that adjustment process that happens, and integration. So the idea behind the program is to help people to attain a higher quality of life and reduce some of the emotional risk and behaviors that are associated with poor mental health. And this is a program that was actually created by a gentleman in Indiana, and it has been part of SAMHSA, the Substance Abuse and Mental Health Services Administration's community defined evidence, which means it's a set of practices that communities have used and determined to yield positive results. So it's not just relying on, folks like us at the university, but it is really being implemented in community settings, and communities are saying this is something that works. That's the idea behind the Community Defined Evidence Project. So with the program, it's about knowing, it's about being, it's about doing. So this program is responsive to many of those best practices that I outlined earlier. And it's designed to be conducted in Spanish. So it wasn't a program that was created in English and translated into Spanish. It was designed in Spanish. And it's meant to be carried out through face-to-face interactions with the community. It addresses many of the concerns that we found to be important. For example, those migration-related stressors, positive coping mechanisms, and addressing the need for identifying and sharing community resources with workers. It's a program that can be conducted anywhere. The idea that our team has been using is actually going out to farm worker housing sites and conducting the program at the housing site. So they don't have to go anywhere. They don't need to find transportation or get time off or do any of that stuff. We're there wherever they may be staying. And if they're off late, we're still there. We're hanging out. We're waiting until they're ready for us to actually conduct the program. And it uses the idea of conversation or charlas rather than me teaching or one of the team members teaching specific things. It's more about the group process and being able to interact with one another and being able to learn from each other. So we're building some of that social support. We're building some of those ideas around group belonging and those cultural values that may be really important, like the idea of family, the idea of the group, and building more of those personal relationships between workers themselves. The program actually consists of 9 modules or 9 lessons, which you can see outlined here on the screen. In working with the program developer, we've reduced this from 9 to a minimum of 5. So we're able to combine certain lessons together to get it down to 5, because when you're thinking about doing 9 different lessons with migrant or seasonal workers once a week, that's 9 weeks. Sometimes we don't have 9 weeks to implement a program. So we've condensed it down to 5, and oftentimes we're adjusting our schedule, for the program to whatever is feasible for the workers. So if they have a day off tomorrow, great. We'll do it a session tomorrow. If maybe they're off Sunday, then we'll do it Sunday. So it may not be a week in between, but we try to be able to fit in. We do fit in all of the content into the 5 sessions into the time that they have available to work with us. So over the past 2 years, now we've done this 2 summers. The first summer we did 1 site, and then last summer we did 3 sites across Nebraska. We try to bring food and refreshments because we know a lot of people, they don't have a lot of money. They're maybe not getting the meals that they thought they would be getting from their employer. So we're trying to bring something for them. The sessions themselves last about an hour and a half to 2 hours or so. They're conducted in Spanish, and for those who complete the program, we've been giving them a $60 cash incentive. So to complete the program, that means participating in at least 80% of the sessions. So if we do 5 sessions, that means that they would participate in at least 4 out of the 5 sessions. This past year, we had 90 people who started the program. We had 72 who actually finished the program, which is pretty amazing. When you think about, many of the guys are working, 12 hours, 14 hours, and then they come to group after that. They're tired, they're hungry, but yet they still come. I think for a lot of people, the $60 is what gets them in the door. But then they realize that they're learning a lot, they're enjoying it, they're having fun, they're getting to know their coworkers better than they ever did. And they come back, they keep coming back, not just for the money, but because they actually have fun. So here you can see some of the characteristics of folks. So over this past summer, it was basically all men who completed the program. We had a couple of H2A groups that participated in the program. But most people were not, they had limited English proficiency, and most people were from Mexico. So you can see a little bit of that here. These are some of our groups that we conducted. So you see that people are sitting together, they're working together on different topics. We try to have a celebration at the end of the program, so everybody gets a certificate at the end. We have a cake and a little graduation kind of ceremony, and it's really important for them because a lot of the guys, they haven't had that experience before, and so they feel really proud when they take their picture with their certificate. I've even had wives who send me messages on WhatsApp and say, thank you, thank you for working with my husband. So that was one group. This is a second group that we had over the summer. And here the guys in the top picture, they were talking about risk and protective factors. So thinking about things at the individual, at the family, and in the community or the environmental level that can have an effect on people's mental health. And then you see their group picture, their group graduation picture. And this is the third group that we did this summer. And you can see on the top picture, we try to do a lot of interactive activities. So it isn't just come and sit and talk. You know, I don't know about you, but after a long day work, I don't want to sit and talk. I want to be up and active and moving, and that keeps people's energy and it keeps their motivation. So we try to do as much interactive types of things as possible. So here they're doing a line activity. So they're talking about experiences that they've had. And so if they've had that experience, they step forward and then they can share. So in this case, they were talking about situations with healthcare providers that they may have experienced and tips for how to better talk with healthcare providers. And then, of course, you see Danny. Danny is also one of our trained facilitators now, who was leading an activity on having fun and the importance of having fun and what that means for all of us in our daily lives. So we're evaluating a lot of different things associated with this program. We're measuring things like self-esteem, life satisfaction, how much you feel like you belong in your group, mental health, coping, stigma, substance use, a lot of different things. And we are seeing some really good results. We're pretty happy with what we're seeing regarding coping. So I told you coping is a pretty big, important issue for us to talk about when we talk about mental health. These are problem-focused coping strategies. So active coping means you're actually doing something to resolve the situation. Positive framing means that you're changing the way that you look at it to see a problem in a different light. And so we've seen some increases in both active coping and positive reframing, which is really good. We've also seen some increases in people saying that they would ask for help if they needed it related to a mental health concern. So we saw significant increases in the number of people who reported that they would talk to their partner, that they would talk to a friend, that they would talk to a parent, they would talk to a mental health professional or to a healthcare provider about their situation. So this is good. We're making progress, and we're pretty happy with these results. We've gotten a lot of positive feedback from the workers themselves. They love the conversation topics. They like the opportunity to be able to share their experiences with one another. They enjoyed the facilitators, the food, the opportunity to have a little bit of downtime and to be able to relax a little bit. We had a lot of people say the thing that they didn't like is that the program didn't last longer and that it got over too quickly. That's a little challenging just logistically, so we'll take that with a grain of salt. But some of the most important things that they said was this idea of convivencia, or being able to be with their coworkers, giving some strategies, concrete, tangible strategies for being able to deal with problems. Talking about communication and differences between passive and aggressive and assertive communication, talking about respect and how you can be respectful, knowing that not everybody has the same style of communication, managing anger and strategies for doing that. And then, of course, substance use and mental health topics. You can see some of the quotes from the workers themselves. They made one said, "You made me feel happy in harmony and recognize the value of convivencia." So I'm taking that idea of convivencia was actually sparked from a lot of the comments that workers left us, to be able to be with my coworkers and the team. It has made me think in another way. It has made me express myself in another way with friends and family. So this program has been really meaningful, I think, to our whole team. You know, it makes for very long days. You all know that when you're driving halfway across the state, and then you wait until workers are there, you do your program and you drive home. So it does make for very long days, but I think I can speak for everybody on our team that we really enjoy this opportunity and this to really give a direct service to the workers themselves. So we know that stress, mental health are really important issues for all of us to be able to address, particularly when we're talking about the farm worker community. And those 3 C's of convivencia, conversación, and conexión are really important elements to help us build trust and facilitate trust, which is our way to be able to address some of these problems that people may be experiencing. And we need programs that are culturally responsive, right? We can't just go in with the one size fits all and expect it to work. So programs like Bienvenido are things that I think we can learn from and that we can actually implement and be a resource for farm workers. And finally, partnerships are a really vital element of all of this work. So we all need to be kind of standing side by side, hand in hand, and being able to work together because there are a lot of resources that we all have, but none of us have all of the resources ourselves. So we do need to work together. We are in the process, my team and I are in the process of developing additional resources. So one of the things that we just recently put together is a flyer in English and Spanish about stress that can be shared with farm workers. What is stress? What are some signs of stress? So what are some things that you can do about stress? So trying to give people a little bit of agency in controlling their situation. Our team is also available to provide training to anybody on the call, to any of the agencies that are here at the conference around mental health. So on the team, we've got a number of people who are trained mental health first aid or youth mental health first aid facilitators. They can do the programs in English or in Spanish, whatever would be most useful to you and your organization. They can do them virtually. They can do them in a hybrid format, or they can do them in person. So just reach out to me if any of that would be of interest. We've also got a number of bilingual team members who are able to facilitate QPR, which is Question, Persuade, Refer, a suicide prevention program. Again, if any of those are of interest, just reach out to me. I'm going to put my email here in the chat and you can contact me, or you can see the link here on the slide. We do have an online contact form if there are any trainings that might be of interest to you or your organization. We are part of the North Central Farm and Ranch Stress Assistance Network, which is funded by the USDA. Here in the North Central region, we have partners in the 12 states of the North Central region, and we've all collaborated together to put together a series of resources in each of the states up online, and you can reach those resources at farmstress.org. And then just a reminder that there are some telephone hotlines that may be good references, good resources for you. 211, of course, I'm sure everybody here knows about already, but any type of social service assistance, that would be a great line to call, available in English, Spanish. You can chat online, you can text, and so you can do a lot of referrals to 211. For any type of mental health concerns, there is 988, which is the Suicide and Crisis Lifeline. That is available in English or Spanish if you call. In English, it's only there. Texting is available. In Spanish, there's a different number to text, but I can share that with you if you're interested. And then, of course, I did want to let people know about the National Hispanic Family Health Helpline. That's a tongue twister, through the National Alliance for Hispanic Health, and that is a toll-free hotline that you can call, 1-866-SU-FAMILIA. And what they will do is provide health information, and if possible, they provide connections to local healthcare providers. So I do want to thank all of our partners. So you've seen a lot of our work across the years now, from research to programming and educational materials and so forth. But I want to thank our partners, especially the Migrant Education Program. You've been amazing supports over the years, Proteus and Legal Aid of Nebraska and Department of Labor. And of course, all of our team. We do have funding that comes from the National Institute for Occupational Safety and Health, as well as the USDA for this work. And I'd be happy to answer any questions that folks may have. So it looks like, Jennifer, you had a question. Can you do individual for mental health training, or does it need to be a group? Ideally a group. For mental health first aid and youth mental health first aid, I think we need to keep it under 30, ideally somewhere around 15 to 20 people would be good. QPR, roughly around 20-25 people would be fine, or fewer, but I would say at least 5. Let me scroll back up through some of the chat. Thank you, Suyapa. We appreciate your compliment on Grand Island. And thank you, Maria Jose, for posting the link to the list. And thanks to Danny for the shout out. You bring up a really good point. So for the Bienvenido program, we've now trained more than 20 new facilitators, not only in Nebraska, but we have a team in Minnesota who's actually implementing Bienvenido right now. We have another one that just started in Milwaukee. Last night, actually, I have a team member over there who's helping get that one off the ground. And we have some other people in Iowa and Colorado who hopefully will be able to implement the program. A shout out to Ita. She's also one of our new facilitators. So we'll be working together closely in the summer to implement Bienvenido. And I'm going to put my email in the chat here. So if you need anything, any resources, connections, information, I'm more than happy to be that link. So feel free, please reach out to me. I'd love to work with you. Our team would love to work with you. And I'll take any other questions if there are any. Otherwise, I do know we're just about at 11:50, which means break time, lunchtime. Okay, everybody, thank you so much. I will turn it over back to Danny.